Hello, I'm Dr. Ashinegi. I'm consultant psychiatrist in older adults. I'm seeing Mrs. Ann Smith, who was referred to us by her GP. Mrs. Ann Smith is a 70-year-old lady who recently lost her husband approximately 6 months ago and has been struggling with her memory. I have taken a detailed history from Mrs. Smith and her daughter, and I'm at the stage of my assessment when I normally administer a memory test called mini mental state examination. Hi Anne, thank you once again for coming to see me and agreeing to do the test. I'm going to ask you a series of questions, few questions really. But if you do struggle with any particular questions, please do not get too worried about it. It is quite common to do that. If it does happen, please, as I said, don't get worried. We will just move on to the next task. Is that all right with you?
Yeah, that'll be okay.
Okay. Shall we start?
Yeah.
Good. Can we start with you telling me what's the date today?
The 20th.
Okay, and what's the month?
April.
Which year are we talking about?
1966.
Good. Okay. What day of the week is today?
I think it might be Monday.
Okay. And if you look outside, what do you think, which season do you think we are in at the moment?
Winter.
Okay, all right. And if you can tell me the place where we are at the moment?
Well, it's some sort of clinic, isn't it?
Okay, good. What floor of the building do you think we are on?
It's the first or the ground.
Which one?
Ground.
Good, okay. And name of the city we are in?
At Stoke.
Good. County?
Staffs.
Country?
England.
Now, what I'm going to do now, I'm going to give you 3 objects to remember. What you need to do is to repeat those 3 objects to me first and try to remember them because I'm going to ask you after some time. Okay? And the 3 objects are apple, table, penny.
Apple, table, penny.
Good. Now, for the next thing, can you tell me the spelling of world? You know, the big wide world. Can you spell world for me?
WORLD.
Good. Can you spell it backwards?
D. No, I'm not sure.
Don't worry. Absolutely no problem. Now, how good you are with your maths?
No, I'm not very good.
Would you still give it a go? And then if you don't struggle, then we just move on to the next one. Can you take away 7 from 100?
No.
Okay, no worries. Now, do you remember those 3 objects I asked you to remember before the world?
No.
Any of them?
No.
Okay, no worries. Now I'm going to show you something. Can you tell me what is that I'm holding in my hands?
A pen.
Good.
A watch.
Okay, good. Now I'm going to say a sentence to you. If you could repeat the whole sentence to me. Is that all right? Yeah. And the sentence goes like this. No ifs, ands, or buts.
No ifs, no buts.
Okay, no worries. Now for the next task, I would like you to take this piece of paper in your hand, whichever hand you prefer, fold it in half and put it on the desk. Thank you for that. Okay, now I'm going to give you a piece of paper and something is written on it. First of all, can you read it?
Close your eyes.
Now, can you do what it says? Good, well done for that. You can open your eyes now. And I wonder if you could write a small sentence for me. Anything that comes into your head, but it has to be a small sentence. Excellent. Well done indeed. It is a sunny day. Right, now what I would like you to do for the next day, if you can copy this design for me. Thank you so much for that. We are nearly at the end. You actually have done really well. Thanks once again. What I'm going to do now, I'm going to request your doctor to run some blood tests and I would refer you for a head scan. I will see you again once I have the results of these tests available to see how best I can help you. Do you have any question at this stage?
No.
Thank you once again. Take care. The history in this case points towards a gradual worsening of short-term memory for past few months, which has been interfering with her day-to-day life. Mrs. Smith scored 19 out of 30 on a mini mental state examination, which again would point towards a possible diagnosis of dementia syndrome, most likely Alzheimer's type in mild stages. I still have to exclude other possible causes of memory difficulties and hence would be requesting the doctor to run some blood tests to exclude other possible or causes of reversible dementia such as full blood count, UNEs, LFTs, TFTs, B12 and folate as well as blood sugar, just to exclude any other reversible causes of dementia. Also, I would be referring her for a CT scan to exclude any other causes of dementia syndrome, such as stroke, cerebrovascular changes, or a tumor. It is important to note that a clear scan does not exclude dementia, as dementia is a clinical diagnosis, and in the process of diagnosing, we put the history, progression, the memory test, as well as CT scan report all together to be able to reach to a diagnosis of dementia syndrome.